How long is the video?
Hi everyone. Hang tight while we get a little adjusted here. Okay, I'm gonna sit really close to you, Kara. Hi everyone, welcome to our Miradry virtual event. My name is Amanda, I'm the practice administrator here, and I've got our two fantastic certified physician assistants sitting with me, Kara and Jessica.
Hi.
Hello. So we're a huge fan of this platform because you can always go back and watch the video later. And you can be in your pajamas. You don't have to come into the office, and you can ask questions via Facebook. So feel free to ask questions. Hopefully we'll answer everything for you, and then you can schedule a consultation tomorrow. But with that being said, I'm going to get the ball rolling here. Jessica and Kara have been performing this procedure for about
Almost 8 years.
Yeah, I was going to say 7, but it probably has been 8 now. Yeah.
So they have a lot of experience, and they have treated quite a few patients, to say the least. So they are your experts. So let's just get into it. So how about you guys talk to me about how Miradry works?
Do you want to go ahead?
Yeah, so Miradry it's basically heat. It's radio frequency, microwave heat, essentially, to destroy the sweat glands. And that's basically the gist of it, just using heat to take care of those sweat glands for you.
Okay, and so when they come in, what is the process, and how do you determine who's the ideal candidate for this procedure?
Well, they come in for a consultation. We really want people to be really educated about what to expect and what the procedure is. And how we determine if they're a good candidate basically is through asking them about their medical history and just making sure that they don't have any contraindications to the procedure. The contraindications to Miradry are few, but you can't be pregnant or breastfeeding or have any implantable magnetic devices like a pacemaker or a defibrillator. You also have to handle lidocaine, okay, not be sensitive to lidocaine in terms of being, allergic to it and actually have it effective for you. And finally, no surgeries in that area. So those are the main contraindications to Miradry. But then we also evaluate you and just, see what you look like anatomically. And we kind of go into the discussion from there.
Okay, so I would presume that my definition of underarm sweat might be different than someone else's. So do you guys recommend that only people with excessive sweating have this procedure, or what would be your suggestion?
Well, I would say that that's more often the candidate, the type of person who comes in is that, they're having excessive sweat or hyperhidrosis, we would call that they just feel like they sweat all the time. It doesn't have to be that they're working out or they're in a situation that's causing them to sweat more, like they're hot, or they're in a situation where maybe they're talking in front of an audience, and obviously that causes people to, sweat a little more. But, it takes care of odor. We also see some hair loss with it too. So, we don't do it necessarily for hair loss, but it does other things too, other than just excessive sweating. And Jessica's had it done, and she doesn't suffer from hyperhidrosis, but she's very satisfied with the results. So
there might be other people that, some people don't want to put the chemicals that are involved with the antiperspirants and the aluminum, and they don't want to have to put those on their body on a daily basis. And so that would be kind of a more natural way to get rid of it. Or maybe they just don't want to sweat. They don't want to have to deal with it. So there'd be a lot of reasons. You don't have to have excessive sweating to benefit from the procedure.
Okay, so I know you guys get this question a lot, but don't we need our sweat glands?
Well, to some extent, you need to be able to sweat to regulate your body temperature, but Fortunately, for your underarms, that only makes up about 2% of your total body surface area that sweats. So if we eliminate some of that, it doesn't really affect your ability to cool yourself down.
Okay, and so hypothetically, if I have this treatment done, I won't all of a sudden start sweating on my arms more.
Good question. No, you shouldn't notice that 2% kind of made up throughout the other places that would sweat.
Okay, that's great. So if I was an ideal candidate without any of those contraindications, you would suggest what next steps? How do you determine that the areas in which I sweat and if the device itself can treat those particular areas? How do you guys go through that process?
Well, so typically, like we talked about earlier, a person would schedule a consultation. We're going over a lot of the things here right now, but we would talk about, are you a good candidate? Tell us about your history. I typically ask about, how often they're sweating. Are they sweating all the time? How it's affecting them, socially. Just physically, how often they're changing clothes. Usually I'll hear, basically I can't wear a certain color ever, or I can only wear black, or, basically, it's just kind of asking them about their history and how it affects them personally. But they basically would schedule a consultation with us, and then we would kind of also take a look at them anatomically, and then they would go ahead and schedule the procedure. But when they come in for the procedure, we also do what's called a starch iodine test, and then that actually shows us exactly where they're sweating. So those areas, when we put the cornstarch on and then the iodine on after that, there's a reaction and all those areas turn dark, and we can see exactly where they're sweating. And so we know exactly which areas to treat. And Miradry is only approved for a certain area, so we can't go beyond that treatment area. But fortunately enough, usually the sweating is, pretty localized to that area that we need to treat. So
seems pretty efficient to me.
Mm-hmm.
Now, how many treatments do you guys recommend to your patients typically?
Typically, it's one treatment. In the past, before they did upgrades a couple of years ago, they would say it would take, 1 to 2 treatments, but expect possibly 2. But since the safe upgrades have happened and that we are able to treat at a greater intensity at a safe level, we usually will only do 1 treatment. But there is an option to do a second one a few months later if the patient feels it's necessary.
Do you find that some people are so happy with the first treatment that they try to see if they get any better results with the second treatment?
So I have only had one person in the last year come in and ask for a second treatment. Everyone has been so happy with one since, like Jessica said, they kind of updated the technology and were able to treat them at that higher energy level setting. And when she came in, she actually kind of, just before I could even ask her about why she was coming in for a second treatment, she just was very forthright with me and saying, I'm so happy, I'm super happy, but I'm so happy that I want to do the second treatment just to see if I can get like 95% reduction. You can get up to 82% reduction with just one treatment with Miradry, but she wanted to see if she could go beyond that with a second treatment and maybe get into the 90-some% reduction with her sweating. And so she actually made it very clear to me that she was really happy with the one, but wanted to just kind of see if she could get really, really good results with 2. And that's why she was doing the second one.
And that seems to be my experience too.
Great. So we have the device behind you guys. Do you want to show them the handpiece and that it's not terribly scary by any means?
Yeah. So this is the Miradry handpiece itself, and when it's turned on and you're ready for your procedure, we'll actually put a disposable hand tip on the top of it. And what that does is when we place it on the skin and we activate it, it suctions up the skin so it can deliver the energy to a certain depth underneath the skin and go right to the level of the sweat glands, odor glands, and hair follicles. So that's it.
Okay, so when you talk heat, obviously I would think that that's a lot of heat to be able to damage those glands. So is the process painful?
Well, do you want to?
Yeah, it's fairly comfortable. We do use, it's called tumescence, where we basically infiltrate the whole underarm area with, it's a solution where we mix lidocaine with saline, and we do buffer it with some sodium bicarbonate so that it doesn't burn and sting as much when we are numbing you. And it is fairly comfortable. Once you're numb, there can be some hot spots, and we do, we ask that the patient, just communicate with us if there are any spots that are too warm. We can always add a little bit more numbing medicine, but I've had patients where they have felt absolutely nothing at all the entire time, and then I've had others where it's just a little bit warm, and sometimes the device, it does actually kind of suction up the tissue a little bit, and so it can feel a little bit pinchy when it does that. But just communicating with us, to a little bit warm to just kind of some hot spots, and if it does get a little bit too intolerable, then we just add a little bit more numbing medicine, and it's overall pretty tolerable. I've never had to discontinue a treatment because the patient could not tolerate it.
Mm-hmm.
Okay, that's great. So is this something that I would need to take a few days off from work or from my activities? What's the downtime and recovery?
So we ask that you don't do any real vigorous aerobic activity for a week afterwards, where you would really where you would do a lot of sweating. So yes, nothing real aerobic. Typically I tell my patients, if, like if you're working from home or something, you're just kind of sitting at a desk, typing at a computer, I think it would be fine to work the next day, because you can still kind of ice the area. You can alternate your ibuprofen, your Tylenol. And if you had to maybe step away from your computer for a little bit and take a little break, if you were just feeling a little too uncomfortable, if you had that kind of flexibility, I think that would be fine. But certainly if you had a more demanding job where maybe you were running around all day long and you don't have as much flexibility to take a break or relax, then you would probably want to plan to take maybe a day or two off. I would say that would be reasonable. Is that what you would?
Yeah, that's
say?
exactly what I say too.
Okay, that's not bad. And then how long does the whole procedure take?
Overall, we tell our patients that it can take about 2 hours. It may be a little less than that, but with the starch test that we do, and then a little bit of setup and the numbing, that's about it.
Mm-hmm.
But the best part is that at the end of 2 hours, it's immediate. When you get off the table, there's no more sweating. So the procedure is done, and your result is there at that time. So that's really exciting.
Great. That's really rare for any procedure, right?
Yeah, typically with a cosmetic procedure, you have to kind of wait for the results, but this is instant gratification, which is really nice. It is immediate.
Okay, so you're microwaving the glands, right? Basically.
Essentially.
Right.
So is it safe?
It is. It's basically just heat energy, and it is just delivered to that area of the skin. It doesn't go below that. It doesn't affect the lower nerves or muscle or anything like that. So that's one of the best things about this, is the safety aspect.
Okay, so there's no potential long-term effects of the procedure, or no?
Not that we've seen. There is some temporary numbness, and we tell people there'll be some swelling afterwards and some discomfort, just like Kara said, that ibuprofen and Tylenol is really helpful for, but the long-term safety has been established.
Oh, that's great. Okay, so sweating is technically a medical condition, right? So is the procedure covered by insurance?
Unfortunately, it's not. It's still considered cosmetic when you're talking about insurance companies. Even back in the day when I, was first in dermatology, been practicing in dermatology for about almost 16 years now, and we used to do a lot of Botox for under the arms hyperhidrosis, and it does work very well. It's temporary. It works maybe up to 6 months, and then you have to do it again. And insurance used to cover that actually really well, and they don't even cover that anymore. So it's just unfortunate that hyperhidrosis we do absolutely consider it a medical condition, a medical problem, but unfortunately, in terms of treating it, a lot of times it is viewed as more of a cosmetic treatment, and so therefore it is an out-of-pocket cost. But the fortunate thing is if you have like an HSA plan or something like that, you can use that money to pay for it. And so that is a nice thing about it, that it is covered under most of those FSA, HSA type plans. So
yeah, that's a definite benefit. Now, is there an age limitation on this? Should, can a 14-year-old come in or an 80-year-old come in? What would be the guideline there?
So typically, elderly people don't really have as much of a problem with sweating, so we don't have a lot of patients that complain about that. But as far as the younger ages, there is. I mean, it is FDA approved, 18 or older. However, in our practice, we take it by case basis, and we have treated a couple of 15-year-olds. We will evaluate the patient and see where they are anatomically and developmentally and see where they're at. But most of our patients are 16 or above.
Okay, so even 16-year-olds can effectively be treated. That's great. Well, what else do you guys have for everyone out there? What do you any other
great long-term treatments?
Yeah.
Well, with our other patients with hyperhidrosis, we always talk about Miradry because we're so passionate about this procedure and because it works so well and it is very safe. But we do have other, topical options that we can offer, and for some people that works well. But sometimes they can be very irritating on the skin. Other things we have, they can also have some other side effects internally, or people don't tolerate them or don't see quite the result. So we sometimes will try other things. It really just depends on the patient and what is best for them.
And I think the other thing that you mentioned, Kara, was that Botox, you have to come in twice a year. What is it on average? About 100 units. Insurance doesn't cover it anymore.
It's going to run probably around $1,200 a treatment. And, in 2 treatments of Botox, you've already exceeded the cost of Miradry. So it's just not cost efficient at all.
Yeah. So the cost for the Miradry,
yeah.
The cost for the Miradry treatment is $2,100 in our office. So basically, like Kara said, a year of Botox, and you've got a permanent solution to the underarm sweat. So now we get a lot of the people questioning whether you can use that adapter on other areas, like the palms, the feet. Can you?
No, it's only approved for the underarms now. They are working on other adapters for other body areas, but so far they haven't come out yet.
Okay, that's great. So this is probably an ideal time of year when we're prepping for sweat season, right? We get a teaser day of 70 degrees and then a massive snowstorm. So probably a great time for our patients to come see you guys, right?
It's a great time.
Yeah. So you guys want to share the exciting news? We are running a special promotion in honor of this event. So what are we offering our patients?
Well, I just learned from you today that it's $200 off your treatment if you sign up before April 15th.
Yeah, so you'd want to schedule your consultation with Kara or Jessica. And then as long as you take advantage of the promotion prior to April 15th, then you get the $200 off, which is exciting.
Yeah, that's great.
Another question we get, because we understand that $2,100 is a fair amount of money for most people, we do offer patient financing through Care Credit. That's something that we can help you apply for, or maybe you already have it from your dentist or your vet appointments. We do have cosmetic patient coordinators that can walk you through that process, or you can do it from the comfort of your own home as well. But we do offer that patient financing, which is great. So do you guys have anything else you want to talk about with regards to side effects or anything with the procedure? You love it. I know you guys love it.
Yeah, we're big fans. I would say that just expect immediately. I mean, yes, the sweat is gone immediately, but also immediately, I would say the most common thing is the swelling. You're going to feel like you have like softballs or water balloons under there pretty immediately. So, I mean, if you live close, I think you can drive yourself home. I don't think that's a problem, but I have had a couple patients who have lived like in Eagle, like past Vale, and I do think that it would be reasonable to bring someone with you to drive you home. Other than that, I can't think of anything else I would.
I think we've covered all of the big things, but I think I would just add that this is probably one of my favorite procedures to do. It's a great time to sit and chat. It's really not that invasive, and it's so exciting to look forward to the future of. It sounds a little cheesy, but kind of changing your life and being able to wear whatever you want to wear and do all the activities that you probably wouldn't be doing if you're considering this.
Yeah, no, I don't think it's cheesy at all. I mean, I think multiple people have said to us that it has been life-changing, really, truly. They're so happy. The satisfaction rate with Miradry is really high. It's higher than most cosmetic procedures. It's in, I can't remember exactly what the percentage is, but it's in the
It's
90s.
high.
Yeah,
Mm-hmm.
92% satisfaction rate or something like that. But people are very, very happy with it. I don't think I ever have anyone call and say it didn't work, or they would have rather tried something else, or yeah, everyone is just really happy. In fact, you get a lot of referrals, just people that have told friends and family members, and just how life-changing it has been for them. So I think it's really, truly probably some of the best $2,100 you'll ever spend, or $1,900 right now.
That's right. That's right.
Yeah. So I think, yeah, it would be, it's a really good option if you suffer from hyperhidrosis, or even like, Jessica was talking about earlier, just sweating in general, and, just not wanting to kind of put chemicals on, or, antiperspirants with aluminum and things like that. So yeah, it's a great option.
Yeah, and eliminating odor. I think that's
Oh yes, definitely
incredible,
especially with the warmer months coming.
And our patients run the gamut, right? Like we see teenagers, we see, fitness instructors, we see businessmen, we see athletes of all different ages. I mean,
males, females, I would
Right.
say equally. I just treated a 58-year-old a couple weeks ago.
Yeah. I don't know, did we mention the actual percentage rate of what the real reduction is in most people? I don't think we said the actual amount.
maybe we didn't.
Up to
I don't-
82% with one treatment.
Yeah.
I think I did mention
And
that earlier.
that's, I think you might have said it, but I just think that's just amazing to reduce it by 82% is the average, but it can be more than that, which is amazing.
Yeah, it's highly effective. I think one of my highlights was, I don't get to interact with patients as much as you guys do, but I was able to talk to a patient who went out and bought a whole new summer wardrobe. She bought all different colors and new tank tops and cute summer dresses, because she finally was able to feel free and not hide herself during the hot summer months.
It's really liberating. People just are so happy to not only wear black.
Yeah,
I just hear all the time, I can only wear black. It's just so liberating. They feel so happy to be able to wear just different, styles and colors, and it is life-changing.
Yeah, and I think it's really important to also note that we've had this device since it first came out, and so we have quite a bit of experience, and we've seen a lot of patients, and the patient satisfaction is real. We don't hear any negative comments about it. Like Kara mentioned, it truly is life-changing, and it's sometimes when new devices come out on the market, it can be scary for people, but this is not a new device. It's tried and true, and we use it frequently. It's we love it. So we hope that these conversations help you and make you feel comfortable, and hopefully answer some of the questions. This type of event is very similar to what the consult process will look like with these ladies. So, but it will obviously be more, it'll be more for you, more geared towards you individually. But we are always happy to answer any questions. If you don't even want to come in for a consult right away and just have some additional questions, like I mentioned earlier, we do have cosmetic patient coordinators available every day of the week. So you can also email questions if you are just like me and you don't have time to get on the phone. You can send those emails to skincare@altavistaderm.com, and we typically respond pretty quickly within business hours. So feel free to shoot us an email. But we do hope that, this brings some light to a great procedure, and it makes people who are suffering from these conditions really aware that there are options for you that are permanent and not temporary. So.
And that you're not alone, and it's a really common problem. And I think people do really suffer silently. I hear that a lot in the consultations, and it's a hard thing to just feel like, with hyperhidrosis especially, you're sitting there and you're not doing anything to sweat, and it's dripping down your sides, and you're layering your clothes, and you're wearing heavy sweatshirts to cover it up because you're embarrassed, and it's 85 degrees outside, and you're trying to cover that up because you're embarrassed. And that's a hard thing. It's, you're not alone, and there is treatment. So yeah, definitely give us a call, because we can help. And it.
We're having internet issues. That was a warning sign to us. But yes, feel free to please call us. The phone number is 303-888-6426. These experts next to me are really looking forward to meeting you and answering any questions that you might have. Reminder that the promotion ends April 15th. So give us a call. If you've already had a consultation with us, great. We're happy to schedule that procedure and honor that discount for you as well. So thank you so much
guys.
for joining us.
We'd love to help you.
We can't wait to see you.
Bye.
See you next time.
Bye.
Bye. All right, if I can figure out how to